Hello and welcome to Well with Del. If this is your first time with us, I'd like to introduce myself. My name is Dr. Jerry Del Canton. On our program, we cover a multitude of topics, most importantly ones you find useful and will help you live a healthier and happier life. Today on our show, we're going to talk about proper sitting posture. And this is our lovely model, Olivia. So she was generous enough to help us out today. And so we're not going to pick too much on your posture today. We're going to show people exactly how they should be sitting. So now if you look at the way Olivia is sitting, now I'm going to pick on you a little bit, I hope you don't mind. But if you look at the way Olivia is sitting right now, she has a lot of weight on her tailbone as opposed to being on her legs. When that happens, we tend to lose that normal curvature that we're supposed to have in the lower back, and then causes her head to get a little bit forward. Now, she's only been sitting here for a short period of time, but you can imagine if Olivia worked at a desk where she did a lot of typing or was using the mouse and the computer, what tends to happen is, and this might be the case for a lot of you, is the head starts to shift a little bit forward. Now, when the head shifts forward, we get a lot of stress and strain in these shoulders, the upper thoracic spine, as well as the base of the skull and into the vertebrae in the upper neck. Now, we've talked about in the past that a lot of times misalignments in the upper neck can lead to headaches and, of course, neck pain. But also, most of the people that you probably know, if you are yourself one that work at a desk, work 6, 8, 10 hours a day at a desk, your shoulders probably feel like rocks. Okay, so this is the reason why that happens. When that head gets shifted forward, we lose that proper curvature in the neck that we're supposed to have, and then we'll get a lot of stress and strain. So what I'm going to ask Olivia to do is, so you can see over time, how does that feel like that, the way that you're sitting? Feel pretty comfortable? Okay, now what I want you to do is I want you to lean forward a little bit, and now I want you to slide your backside back to the table and sit a little bit more upright, just like that, without your back touching. Now at this, you can see her weight is going to be more on the bottom of her thighs, away from that tailbone, which incidentally, people that sit on their tailbone lead to sacroiliitis, low back problems, something that we can cover in some other topics for a different day. But for right now, ideally this is the way we want to see her sitting. Now, how long do you think you could sit like that for?
Probably not too long.
Not too long. Yeah, so ideally, yeah, this would be great, but no one's going to be able to sit like this for too long, because what happens then is we get back to that posture, the shoulders start to round, the head gets forward because we fatigue. So most people are not going to be able to sit like that for a prolonged period of time. What we recommend that we do is we want to put something, and for women I tell them it should be right at the base of the bra line, is we want to take something and create a lumbar support. Now this is just our dog bone pillow. You could roll up anything, a sweatshirt, a towel, put some gum bands on it. But what you want to do when you put this behind your back, and a lot of people make the mistake, they put it down here in the lumbar support. Now if you watch, if it's down there low, you're going to see the patient's going to become sway back, and then as they're working on their computer, their head's going to jut forward even more, once again creating that stress and strain in the neck that we don't want to see. So the low back support, like a lot of times patients will tell me, well, I have this support in my car, or I put it down on my low back in my work chair. It's not the way to do it. You want it to be up higher. So we want it right at the base of that bra line, or for men, you just want to basically be at the bottom of the rib cage. And now you can see, now she slides her backside back an inch or so, if you can. Now you can see she's naturally creating this curvature on her own, and now she has the support that she needs to be able to sit upright. Does that feel a little bit better like that?
It feels a lot better.
Yeah, so it's going to take a lot of stress off the neck, off of the shoulders. And this is a simple thing. Everybody has a towel in their house and 3 gum bands to throw around it. The other device that I love that works fantastic is, lean forward here please, is this device. Now when this first came out, this was designed for people to lay over top of. The original make of this was called the Magic Back, and now there's a bunch of knockoffs out there now, and this is adjustable based on how steep we want the curvature. So what I do with people is I'll tell them to take this, and you can put that right there, and once again, this is extremely comfortable. A towel is going to start to compress. These are found, you can buy them on Amazon, you can find them pretty much anywhere. They're not expensive, they're adjustable, they'll last you forever, and they work great. So this is a great place to have it like this. Sometimes I'll have people put it horizontal, depending on their size. Now Olivia, she's on the petiter side, but someone like my size is probably going to need something a little bit bigger, such as this device here. So once again, you want to naturally create the arch in the lower back, and you do that by putting something right in the middle of the back, not the lumbar spine. And this will help out with the neck, the head, the shoulders, and the entire spine. So that's our tip for today. We hope you enjoy it. If you like what we had to say, please like our page, and we love it if you followed us. So until next time, we'll see ya.